Hello and welcome to Workforce Wisdom. I'm your host, Christy Bray, Chief Customer Officer at PracticeLink. This podcast explores the latest trends in healthcare recruitment, highlighting innovative strategies, success stories, and fresh perspectives that are transforming the healthcare workforce. These episodes will lead to in-depth, thoughtful discussions with recognized industry-leading healthcare professionals, exploring the challenges of healthcare recruitment and beyond. Whether you're an experienced recruitment professional or just starting out, this podcast aims to help you discover how experts are reshaping the industry, leveraging technology, and fostering inclusive hiring practices. Today's episode, Leading with Innovation in Virtual Care with Christopher Northam. Welcome, Christopher.
Hi, Christy. Thanks so much for having me today.
For the audience, Christopher is an experienced healthcare executive with 25 years of excellence in scaling operations, driving digital transformation, and leading strategic initiatives across leading Fortune 75 healthcare organizations and the U.S. Army. Christopher is a colonel in the U.S. Army Reserves and a combat veteran. He is recognized for building and leading high-performing teams while fostering a culture of creativity, collaboration, and operational excellence. So, Christopher, when a health system is just starting to consider telehealth, what is the first thing you recommend that they do?
I think that it's crucially important for them to consider why they're looking at a telehealth solution and truly recognizing that it's more important for them to focus on care delivery and the standard of care than the technology, which oftentimes people are gravitating towards the technology, thinking that that's the solution instead of just the modality, which is really important for them to say, okay, how can I maintain my standard of care and utilize telehealth as a modality to deliver it to a broader population?
Yeah. I think that's really important that you don't lose track of what healthcare is supposed to be, helping the patients and really making sure that that's your reasoning and your influence. So you've been on the forefront of digital health for a while. How do you see telehealth fitting into the bigger picture of an organization's strategy?
I would say that certainly all of us recognize that COVID accelerated the use and adoption and true appreciation, and that I think innovation cycle was generated by COVID as well. So I think that it needs to be seen as a core element of the business in order for leaders to not have it just be a sidecar, right? It shouldn't just be a bolt-on, but how can we make sure that we evaluate our current workflows and modify those workflows, right? I think that one of the mistakes that maybe happens less than it used to is people would look at a physical process and say, okay, we're going to transform this to a virtual process and maintain the same number of steps and not really go back to the drawing board to figure out how can we make the process better, more efficient, and really ensure that we're not just taking a physical process and converting it to a virtual process and not gaining anything and potentially losing.
Yeah, because ideally you want to leverage the technology in that situation to save time for both the clinician and then the patient. From your experience, what are some of the most common pitfalls when launching a telehealth program, and maybe give some advice to leaders to help them sidestep those pitfalls?
I think that probably one of the most common things that I've experienced over the last 20 years, when teams, leaders are focused on innovating, they see something and gravitate towards that something, that shiny object that, I've got a solution, what's my problem? Instead of really being process disciplined around evaluating what the problem is and then evaluating what are the most appropriate capabilities, solutions that they can apply in order to solve and overcome that problem.
Yeah. Do you think they kind of overthink it?
I think that people see something and say that's good enough, or see something and are just gravitating towards the easy button, if you will, right? Just, this is complex, it's difficult, I want to make it easier. That looks like a solution that could and would make it easier. Let's just do that.
Yeah. I kind of feel like that's a challenge for almost any healthcare organization, that you want to push that easy button on a lot of things that you're doing within the practice scope or the hospital.
Yeah.
So let's talk about the tech side. What tools or platforms do you think are non-negotiable for building a telehealth program that really works?
I think the best programs that I've seen or been part of building take the approach that we're going to build the right solution, and if we can do it quickly, we will. But despite how fast or slow it takes, we're going to build the right solution. We're going to use the right technology. We're going to build an expandable program, right, that can scale across the enterprise and really continue to accommodate the growth across the enterprise to serve a broader patient and provider population. So I really think that not rushing, but having a solid strategy and then beginning to deliberately execute against that solid strategy is where I've seen the greatest success. And oftentimes it is incremental. If you rush, you won't realize that we're making a series of mistakes or have these insights that we can apply to continue to refine and improve the solution or solutions.
Yeah. And I'm sure within those solutions, integration is vital if it's different tools talking to each other and really the EHRs. So how do you approach, making sure that the telehealth platform, plays nicely with existing EHRs or maybe what are some of the other systems the integration is key?
Over the course of the last 5 years, we've made a lot of advancements. We as a society have made an awful lot of advancements to allow for APIs and HL7s to do a lot of that interoperability, that data sharing, and be able to ensure that we're capturing the right information and storing and querying the right information and then stratifying that information so that it's actionable, right? Instead of just collecting an abundance of information and making a complex problem even more complex, being able to take that complex problem and really use the technology. And I think AI certainly, as we were talking about before we started today, has made so many advances on being able to synthesize a large body of information and then really help determine where are the greatest opportunities for applying that vast amount of knowledge in order to have the outcomes that we're seeking, whether those are patient outcomes, whether they're efficiency outcomes, and so forth.
Yeah. Talked about some key components there. Is there anything that might be like smaller or some other things that when they're selecting vendor partners for telehealth that might get missed? They're the less shiny object.
Really in my experience, selecting vendor partners, if we're going to dissect that term a little bit, the vendors that I've worked with that are the best are solution partners. And when I say that, I mean that they might be selling a product or products, a service, but if they really seek to understand their client and therefore really start to anticipate how can I continue to make this service or this product better to serve this client or this category of clients, that is, I think, a dynamic environment that really allows for continuous growth. And I think that those are the best partners that I have worked with over the course of my career and I don't wait for that to occur. Oftentimes in my vendor selection, I'm going to be right up front with, this is what I'm looking for. And it's not just maybe the product and or services that we're there to contract. It's if I look 1 year ahead, 3 years ahead, 5 years ahead, and you're a long-term partner, what's your company's methodology to make sure that together we're getting stronger and better? And I think that's key to that solution partner relationship.
Yeah, that solution mindset is probably key. If vendors don't have that, I think it's a huge miss. It isn't just about the sale, as you said. So you've led operations in some extraordinarily complex and large nationwide environments or more. What operational models have you seen that make telehealth both efficient and sustainable?
I think first and foremost, the model that I have leaned the most on and would recommend is communications. So oftentimes people hear transformation or innovation across an organization, and maybe the leader or the team leading that feels really empowered and enthusiastic, and others see that as a threat or a risk. And I really do believe that innovation is a different type of wrapper for change management, right? And so communications is important, and being able to have people understand at the onset what we're looking to change, why we're looking to change, the outcomes that we're seeking, what's the end state, I think is critically important, rather than allowing people to write their own narrative that support and are affected by that change management, also, oftentimes called in large organizations transformation or innovation.
Yeah. So in the opposite direction, what are some of the against arguments that you've kind of come up against with folks that are kind of standoffish about making those changes to a telehealth model?
So I would tell you that probably about a decade ago, when I was leading a large enterprise rollout of an emergent telehealth program, oftentimes the physicians in the hospitals that were going to receive, I'm going to use telestroke neurology as the example, that were going to receive support from a telehealth physician, a stroke neurologist remotely beaming in to support their patient and make a real-time assessment based on the diagnostic information and the patient examination. And oftentimes, I think there was limited thinking by the physicians on site, let's say the emergency room physicians and staff, believing that there's no way that somebody with that finely tuned skill set of clinical capabilities can utilize an audio and video feed in order to determine some life and death decisions. And I think that we've proven time and time again, hundreds of thousands, millions of times now in these encounters, that the speed matters, being able to provide scarce resources, and most importantly, being able to assure and maintain that the standard of care is at or above that same standard as the in-person encounter. And I think that I think all comes back to communications, right? I think if we allow people to write their own narrative when there's something new that they're presented with, that sometimes the narrative is really positive and sometimes the narrative is threatening, or they might think that that's a dilution of care. And I think overcoming that by having that honest dialogue and saying, hey, we have higher standards oftentimes for this level of care than the in-person, and we can deliver it more consistently and we can measure it more effectively. And so on a continuous basis, there is improvement that is generated through the delivery of telehealth.
Yeah. And I think that, to your point, the telestroke is a perfect example, knowing the shortage of neurologists in this country, and that definitely the rural and underserved communities will continue to be that. They will not have access to have an on-site physician. They'll be lucky if they have a nurse practitioner who, maybe has a background in neurology, but without a telehealth component, those things will be missed. And we know, stroke and cardiac definitely have that time is of the essence component related to them.
Yeah, it's a fascinating space. I think a lot of people jump to conclusions on what does telehealth mean, and is that receiving a telehealth encounter on your phone? And certainly that's part of it. For those outpatient ambulatory encounters, whether they're behavioral or dermatological, or it's a wellness visit, I think those are crucially important and allow for that continuity of care for the patient. But to your point, we continue to have scarce resources and a real need to be able to deliver those scarce resources as effectively and efficiently as possible across entire regions or across the nation. And in order to do so, we have to ensure that we build programs that really harness the best of our physical and in-person care and our virtual and these automation techniques, clinical decision support solutions, in order to bring all that together to realize the best outcome for our patients.
Yeah. So we've talked a lot about kind of balancing that high quality clinical care, and maybe even a step up from telehealth may be held even at a higher standard of care. How do you really ensure that the patients have a positive seamless virtual experience. That might be easier in your primary care setting, where in the emergency room it's a little bit different. But how do you really help maybe educate the patients about what their interactions will be like?
Sure. Generally, we refer to that as webside manner. So my teams and I actually have that instead of bedside manner, which all of us are really familiar with, being able to have that website manner and really find ways that consistently allow for the patient to be put at ease and to engage with the provider remotely. And I think a lot of that is reassurance on the physician or that provider having that quick conversation to say, hey, we understand how complex this is and that this is a scary situation that you're dealing with. And the fastest way for you to get the best care is for me or a member of my team to beam in to support you with the certain clinical challenge that you're addressing right now. And I think all of this, I know that that's an undercurrent across our entire conversation, but the communications is really that bedrock for establishing and maintaining the trust with the patient and the providers that we're supporting through telehealth.
Yeah. I have to ask, do you use the phrase beam in whenever you are implementing these programs?
That we use different technology terms to say, but beam in is pretty common. I will tell you though that it's probably been about 10 years ago that there was a common term that was robot was used for the endpoint for the cart in hospitals and clinics and other settings, brick and mortar settings where we were delivering telehealth. And people would talk about the robot and, I'll go get the robot. And I really think that one of the cautions that my team and I had on that was, words really matter. And it dehumanizes the fact that the robot's not going to do the work. The human on the other end of that went to school for 15 years or 20 years to be world class on delivering that care, that's who's going to deliver, that. And it's a modality. Telehealth is the modality. That is the way we deliver it, but it is the care on both ends that's generated by the patient and that provider that has the right skill set.
Mm-hmm. Yeah, definitely in that setting, I can see the words do matter in taking away some of the anxiety the patient probably already has because they're not in the hospital by choice, and so it really would matter how the clinical staff is positioning, that care that's going to start happening. What are some of the key metrics that your teams track to really know if a telehealth program is on the right path?
I think if we just focus on the technology for a moment, being able to have consistency, eliminating latency, making sure that we've got consistent uptime and that we have redundancy, so failover capabilities in the event that different communications platforms are challenged. How do we make sure that we can still deliver the care that we're committed to deliver, even when, let's say, a hurricane occurs and we have the disruption of telehealth because of those standard lines? What are the backup, those contingencies that we build to have business continuity and therefore continuity of these resources? So I would say that just from the technology standpoint, it's critically important to make sure that those things, not all the upside is considered, but what's the downside and the risks, and what are we going to do to mitigate those risks?
Did you know PracticeLink, the nation's most trusted physician recruitment resource, now offers PracticeLink Pro Marketing? PracticeLink Pro Marketing is a brand new, powerful recruitment sourcing solution built just for healthcare organizations. With custom strategies, targeted reach, and data-driven results, PracticeLink Pro Marketing helps you attract top-tier candidates and fill hard-to-reach roles faster. Ready to elevate your recruitment game? Visit PracticeLink.com and schedule your free consultation today.
We talked a little bit about, bedside manner is a little bit different in this remote type environment or virtual environment. So training those providers to work in a virtual care setting is different ballgame. Are there some best practices that you've seen that work well that help the clinicians kind of, be able to provide that world-class care quicker?
Yeah. One of the things I think all of us that have had a in-office visit with, let's say, our primary care physician over the last 10 or 15 years, and they're spending a lot of time focused on the computer and the electronic medical record and drop downs and making sure that they get all the right information. And what I would say is the advances that we've seen in office and through telehealth for being able to use scribing and other solutions so that we can really focus on the patient and not focus on capturing all the data so that we get it coded right and that it makes, sure that it's billable and all the other facets that are critically important, but not as important as being able to engage the patient, right? If the patient feels like the computer's more important, then that really undermines the level of trust and engagement that physician and that patient are supposed to have in that encounter.
Yeah. And I think, helping organizations build those strong patient relationships, is that a component that your team, really focused on both for the on-site staff? Like we said, let's probably not call it a robot, but the on-site staff and building that bridge where that provider could be, all the way across the country.
I would say that these care teams are oftentimes developed with these telehealth providers that they're going to be on the same service or schedule on a recurring basis, certainly on the hospital side, right? So if you're working inside an emergency room or an ICU and you have pulmonologists and intensivists and other specialty providers that are beaming in to support and assist, augment your care team, oftentimes that is not a one-off, right? These are services that are consistently built. Those providers on the hospital side are part of that medical staff, right? They're credentialed and privileged in the same way. They have the same provisioning in the emergency or in the electronic medical record. So it really is in every way but being in the room physically the same. They have the same access to the radiology and other diagnostics and lab reports and all the other elements in patient history to be able to determine how can I make sure that my role here on this care team is as effective as this team needs me to be for the patient.
Mm-hmm. I'm sure there are certain specialties where tele is a little bit easier from a diagnostic standpoint than other, maybe other specialties. But I'm curious, as this becomes more of a care delivery model over time, how do you see maybe even some of the training programs that nurses or physicians are coming out of where, their role is evolving? I don't know that it'll be an ACG accredited, subspecialty at some point, but it's kind of an interesting thing to think about as more and more pieces and components will move into this tele-virtual environment.
One of the areas that I've seen over the last 5 years really start to be applied very effectively over hospitals, remote, rural, medically underserved communities, as well as metropolitan hospitals, is the advent of virtual nursing programs and being able to have those nurses move from room to room virtually to round on the patient the same way that physicians round on the patient, oftentimes virtually. It allows for near instant availability as well, right? Instead of I hit my call button and I wait for 15 minutes because my nurse is taking care of another patient and may not really be able to leave that patient's bedside until they're, completed with that task. And what this allows is for, number one, for communication and reassurance for another nurse who might be on site or might be off site to beam in, to provide the reassurance, to understand what the problem is. Is that a quick solution? Is a long-term solution? Do I need to request another specialist or lab to come up? Or, are you trying to get in touch with a family member? So it really, I think, allows the telenursing as allowing us greater efficiency, greater care, greater consistency. And I think that there are probably lots of other applications that I would think in the next coming years that we're going to see, that now that we're putting the plumbing in place to be able to have these technologies that are voice activated, that allow for patient privacy if they don't want the camera to come on, or if they do want the camera to come on, that they've got a simple cue card that they're able to use to say, I need to speak with my nurse, camera on. I mean, so there are so many really amazing elements of this that allow the patient to have a greater role in their care delivery while they're in the hospital.
Yeah. I know in a market I previously served, it was a great area for us to capture those nurses. Nursing and the amount of strain it puts on you physically, can make their careers a little bit shorter. The distances they're walking, maybe the patient lifting, but we were able to take those, what would have been retired, leaving the workforce nurses, still have that same skill set, and they could sit and provide the care like you described, where patients are popping up and using their call buttons. And I think anywhere we can save resource from a human standpoint, with that experience, that's priceless. To be able to, that nurse can they probably still want to work, but physically,
Sure.
they've got some challenges there.
And I would tell you that, similar to some of my other comments in our discussion, it's not a substitution, it's an enhancement, right? And so I think that that's another important, we wouldn't want patients to think that I'm relegated to somebody that may not even be on site. They need to understand, okay, we care about your care so much that we're going to put a program in place that you have near real-time response, that we can understand how to triage what it is that is challenging you at that moment and apply the best care that we can as quickly as possible. And then when appropriate, get that physical team in the room, back in the room, to be able to support that patient. But knowing that patient has that resource or those resources, I think is a tremendous advancement, and it allows for patients to feel like they're not isolated, but they're accompanied, and that accompaniment is under their control.
Sure. So as you scaled the programs, that you've put in place over the past 10 plus years, so how do you come up against some hurdles with patients? They might struggle with the technology. Maybe they don't have the broadband access that's needed. From that side, beyond just trusting the process, the communities that you served, how did you overcome some of those difficulties?
One of the primary ways was doing an initial assessment, number one, to understand what the capabilities were. And there would, in some communities, that outreach would have to have a modification element. If they couldn't get the appropriate signal, broadband and so forth, in order to have the real-time audio video, then they would identify in their community, where are those places that I can have a HIPAA compliant encounter, where I can go and have that encounter. And sometimes that would be, at the public library in the parking lot, where they could get broadband, where they could get a Wi-Fi signal, and other places, fire stations, and other places that in lots of underserved communities, remote and rural, do have a larger footprint of those services so that they can support those kind of examples for, patient care. Oftentimes also, though, being able to put remote patient monitoring and have store and forward, we can have sync and async. And so being able to say, some of this is going to be real time, some of this is going to be store and forward, and we're going to have that information uploaded for my physician or care team to review. And it's not going to be real time, and that they're going to be able to correspond back with me, and I'll be on the lookout for that message, that email to come back in order to not be completely reliant on what otherwise might be an inferior communications platform for some of those remote and rural locations.
Mm-hmm. And I know the remote patient monitoring is I mean, that business is booming. The technology is improving so fast where we are able to get people out of the hospital appropriately, but at a quicker pace where then they still have that monitoring is happening, and the cardiologist or the clinicians are still seeing the data they need to see, and you're not there in the hospital bed.
You wouldn't want to think that that's an absolute, right? Because not every patient's suited for that. Not every patient's home or town is suited for that, from a support standpoint, for family support, for technology. So not making an assumption that one solution fits all, especially in the remote patient monitoring space, to your point, it's hugely important that people recognize that it doesn't require as much of a signal. If it's not video, these are smaller packet sizes. And just like when you can't make a phone call sometimes and you can send a text message, it's the same concept as that. I can still get the necessary information out, but it may not be as enhanced of a encounter.
Mm-hmm. Right. Okay, so as we look ahead, get your crystal ball out here, but where do you really see the most significant opportunities for telehealth and virtual care growth in the next 5 to 10 years?
I think we're going to stop calling it telehealth and virtual health. I think that's, again, I'm back to my communications theme. I think that we don't say we're going to get on the internet in order to get on Google, in order to, check the news or whatever. I think that we're going to stop thinking that it's unique and that it's a standard. When I served on the board of the American Telemedicine Association, one of the challenges that all of us had for our community was we really want to have a society eventually that doesn't see telehealth as something separate, that sees it as ubiquitous. And I think we're getting closer to that ubiquity all the time, that it is part of the standard of care. As we said before, it's not a dilution of care. It's not a separate way to deliver care. It's a modality for delivering care that when it's most appropriate, we're going to deliver that level of care.
Yeah. We've talked about, some emerging tech, AI, and remote patient monitoring. Is there anything we've missed? Is there anything in the market that you've seen that is a huge game changer?
For AI, I have some level of apprehension, not for us to not use it, but to be cautious and thorough as we look to implement AI into platforms that allow for capturing, as we said, a lot of information, summarizing that information, and then being able to determine what's the most appropriate action to be taken. And I think that area is still evolving and still has a lot of evolution to occur before we lean too heavily on it. So I would hate for us to rush to failure on applying too much AI. I mean, that this is not saying that we need to stay in the dark ages and that things still have to be completely person-centric, but making sure that we're monitoring to determine, are we maintaining the standards, or have we taken a shortcut? And that shortcut is the beginning of us diluting or undermining the care that we seek to deliver.
So if you're advising, and I know you do this, but if you're advising organizations today, how would you tell them to prepare for the future of telehealth so that they can stay ahead?
I would say that they should focus on telehealth as a core part of their strategy, that shouldn't be an afterthought. It should really be, what is the standard of care, or what are the areas that we're going to focus on? And then the same way that we would look at talent management in a brick and mortar with a team like yours to determine, how do I attract the best, brightest, most capable, most talented providers to a brick and mortar, to those hospital facilities, those clinics, those practices, being able to do the same, right? To ensure that we don't have a different standard for telehealth, and that we really are recruiting around the fact that this is an opportunity. It doesn't have to exclusively be the way that you deliver care, but it's an opportunity for you to care for your patients in a more flexible way, in a more consistent way, and also for you to have potentially a higher quality of life by not always having to go to a brick and mortar facility to deliver that care to your patients.
Yeah, and that's definitely what my team saw when if we had the opportunity to recruit someone for a teleposition, that work-life balance, or, that balance is what everybody's asking for, not just physicians, but, the workforce is pretty much demanding that they get a say in where they work these days.
Well, and some prime examples of that are parents that, have young children and want to, let's say moms that really want to work part-time or have a more flexible schedule to be able to accommodate raising their children, or, people later in their career that want to start to step down, as you said, like you used the nurse example, but other providers that are saying, I only want to work half time, or I only want to work 6 months out of the year, but being able to have that flexibility, not lose the resource. On a national front, we can't afford for people to just take all their knowledge and now go sailing or golfing and not continue to contribute to the well-being of our communities. And so if we can have those compromises and not just be very binary about it's either or, I need you to work 8-hour shifts 5 days a week, instead being able to say, hey, what works for you that works for us, and how can we match that up so that we have a win-win solution?
Yeah. Yeah. So in your experience, are there certain specialties that have had, a greater or even a quicker impact that our recruiter audience would be interested in learning about? So, thinking about the community didn't have access before, and through a teleconnection, now they're able to open that door or that specialty treatment area that's available to them now through a virtual environment.
I'm going to use telematernal fetal medicine as the example that I would say over my career really showed the greatest benefit, to your point, as very quickly being able to have our maternal fetal medicine physicians in metropolitan cities like Dallas or Kansas City and so forth be able to support communities through outreach arrangements, through these clinics that on a weekly basis, maybe a monthly basis, that the physicians, that OBGYN and that local community would be able to schedule that enhanced capability or on demand, right? I've got a patient coming in, she's got a concern or a risk. I'm going to get our ultrasound technician in here tomorrow at 2:00. Can I get my maternal fetal medicine physician in at the same time? You can certainly capture that, store and forward those images and so forth, that the diagnostics, but being able to have it real time allows the patient to feel a higher level of care, and also for that maternal fetal medicine physician to be part of that care team with that local provider as well as the patient, and maybe get better images, maybe be able to provide some real-time coaching that mom who's concerned about this complex and troubled pregnancy potentially, to be able to have them have some of their concerns assuaged, and cautions and coaching that might be able to be applied immediately during that encounter.
Yeah. So I'd like to ask, are there specialties that telehealth doesn't work in? I know I've looked at a broad range, and urology was one that we kind of got stuck on. It was explained to me by some expert telehealth folks. And to your point about getting the physicians on board, the on-site physicians can be a challenge. But are there specialties that don't perform well in a remote environment?
I think those specialties which would require that specialist to actually perform the invasive procedures are a lot more challenging. Not to say, I wouldn't want to say that as an absolute, because there are teleproctoring and telementoring programs for a physician to assist in a surgery, but they can't be the lead on that if they're that telehealth provider, right? So I think that some of those limitations really are those specialties which would require that specialist to be the one essentially performing that invasive procedure. I think that there's probably other places that are novelties that are just probably a waste of resources as well. And I've seen, a handful of those over the years that people start to get so excited about the fact that really I don't see a limit to telehealth, right? We can use it for everything. I've always said that we shouldn't do telehealth for telehealth's sake, right? We should be solving a particular problem or opportunity, and that's why we're using telehealth, not just because we can, but because we should.
Yeah. I really like that answer. I think the Euro example really was having them understand the new technology that's available from a diagnostic standpoint. You're doing a lot of education for your physicians to say, oh, by the way, there's this and that and whatever. And then this is how those images come across. We did a lot of education with them to try and get them comfortable with just overnight coverage. It wasn't anything else. But I think the real advancements that will help are all of the diagnostic tools.
Absolutely.
Yeah. Christopher, thank you for sharing your expertise and experience in shaping telehealth programs that truly work for both patients and providers. From strategy and infrastructure to patient engagement and future innovations, your insights give us a roadmap for building sustainable, future-ready care models. Thanks again.
I appreciate it. Thanks so much, Christy. Take care.
If you enjoyed this episode, be sure to subscribe to Workforce Wisdom on Apple Podcasts, Spotify, or wherever you listen. And if you've learned something valuable today, share it with a colleague who could use a little inspiration in their work. You can find more resources, including past episodes and healthcare recruitment insights, in the PracticeLink Resource Center at practicelink.com. Additionally, we'll welcome your thoughts. So if this episode sparked a question or idea, please don't hesitate to reach us at plmedia@practicelink.com.